Broadcast is now starting. All attendees are in listen-only mode.
Welcome, everyone. Thanks for joining us for the National Farm to School Network April Trending Topics webinar, Farm to Early Care and Education. We'll give everyone just a moment to jump on the webinar line and then we'll get started. Welcome, everyone. Thanks for joining the National Farm to School Network Trending Topics webinar. We'll get started in just one moment. Good afternoon, everyone. Thank you for joining the April National Farm to School Network Trending Topics webinar focused in farm to early care and education. Today's topic is family engagement through farm to early care and education. My name is Lacey Stevens. I'm a program manager with the National Farm to School Network, and I'll be your host and moderator for today's webinar. Just a few housekeeping reminders before we get started. This webinar will be recorded and archived for future viewing in the National Farm to School Network resource database, and you'll also receive a link to access this recording in the follow-up email, which will also include links to resources and reports shared by our speakers today. All of our attendees are in listen-only mode, so as you do have questions for our panelists, please feel free to enter those into the question box on your control panel as those come up for you. We will have plenty of time for question and answers for our panelists at the end of the session today. So as those come up, please continue to enter those questions in the question box. We do invite you to attend all of our Trending Topics webinars. National Farm to School Networks hold these webinars on a monthly basis, the first Thursday of every month, and Farm to Early Care and Education is a focus of those webinars on a quarterly basis. So please mark your calendars for those upcoming events. Before we get into our topic of the day, I'd like to share some of those upcoming webinars with you. Coming up in May, we have our May Trending Topics webinar focused on state farm to school networks. And in June, we have our webinar focused on state farm to school positions. We'll be releasing some exciting new resources, and you'll hear from some of our core and supporting partners from across the country about their networks and state positions around farm to school and farm to early care and education. So please mark those dates on your calendar, and we'll send those registration links to you along with that follow-up email. We're also very excited to invite all of you to join us in Cincinnati in less than 3 weeks for the 9th National Farm to Cafeteria Conference. We only have a few days left to register. Registration closes on Monday, April 9th. So if you're interested, please take a look at farmtoschool.org/conference and register soon. This biennial event convenes more than 1,000 diverse stakeholders working to source local food for institutional cafeterias and to foster a culture of food and agricultural literacy across America. This is the premier opportunity for networking and taking your farm to school and farm to early care and education activities to the next level. Specific to farm to early care and education, we've got a fantastic full track, including breakout sessions, field trips, and short courses, and would love to see you in Cincinnati. So today, getting down to our topic at hand, we are exploring a vital and exciting topic, looking at family engagement in farm to early care and education. So I'll get us started with a brief overview of the role of family engagement in farm to early care and education, and then we'll hear from our two guest presenters, Halisa Johnson of Northeast Iowa Food and Fitness and Ellen Schmidt of Northeastern University. And they'll share with us their programs and experiences in engaging families and parents in the Northeast Iowa Food and Fitness program and in the Farm to Family program. So when we look at these, what is farm to early care and education, and we look at these core elements, we know that farm to school and farm to early care and education initiatives all look different, but they generally include at least one of these core elements: the procurement piece, the school garden piece, and then that broad education piece. We'll hear from our speakers today about how there really are opportunities for meaningful family engagement within all of these elements, from family workdays in the garden to seasonal celebrations of local food. And as we think about the benefits of farm to school and farm to early care and education and what we call our triple win, where kids are winning, farmers winning, and communities are winning, these benefits are really only enhanced and doubled when we think about bringing family engagement into all of these pieces and pictures. And of course, as we look more specifically at bringing these core elements into the early care and education setting, we have these compounding benefits that offer additional leverage points to affect change and advance equity in the early care and education system. And today we'll really be honing in on this family and community engagement piece and the overlap of that family and community engagement with programmatic and early learning standards. And as we always like to talk about, these benefits and the opportunities that we can offer with farm to early care and education are really a tool to help programs meet these programmatic and early learning standards and these bigger picture goals that the early care and education community is working towards. So as we think about family engagement and farm to early care and education, we know that many early care and education settings are really not just aiming to serve the child, but aiming to serve the whole family. And we also know that health interventions, like exposing children to new foods and increasing consumption of new healthy foods, are most impactful when we can influence multiple environments. So making changes both in the early care and education setting and taking that home to make changes in the home setting as well. And what we do know about parent engagement is that it's really most successful when interventions offer opportunities for active engagement and feedback. So parents and kids can try things out together, experiment and practice and engage with one another. We can have the opportunity with farm to early care and education initiatives to not just tell parents what to do and how to engage in the program and with their children, but show and actively engage in these new learning experiences for children and families. Another great benefit is that we're not asking parents to do a million different activities to provide a lot of meaningful learning experiences, like cooking together, for example. We can hit on these multiple domains of learning, from nutrition to language to math and science, with one fun, meaningful activity. We also have an opportunity with farm to early care and education to connect with the community, with culture, with heritage through food and through food experiences. And we have a plethora of different activities, and we'll be hearing some more of these different examples and these examples in action from our presenters today. Now, as we start to think about these overlapping opportunities with program and early learning standards, this is an example from our National Farm to School resource supporting Head Start success with farm to early care and education. So as we think about opportunities to meet this specific standard, parent and family engagement in education and child development services, we can see there are numerous activities from all three of the core elements that can help address this standard, this program performance standard, from establishing the center as an access point for on-site farmers markets or CSA, to engaging families in those gardening activities and using the garden space as a gathering place. To take it a step further, if we're thinking about how to connect parents and families to those community access points, and with this program performance standard offering family support services for health, nutrition, and mental health, we're really bringing that community aspect of farm to early care and education along with that family connection. And we have a lot of opportunities to build those community-based relationships to support better access to healthy food, better access to gardening opportunities and nutrition education opportunities. And so while these examples are specific to Head Start, there are numerous other types of standards, whether that's NAEYC early learning program standards, and even state QRAS standards that integrate these similar expectations and experiences. And that same holds true for early learning standards. So this is an example again from our Head Start resource. But many of these Head Start learning standards certainly mirror many state learning standards as well. So you can see how family engagement and farm to early care and education really combine to address these example standards, from social emotional approaches and to approaches to learning domains. So now let's hear a little bit more about these family engagement opportunities in action. I'd like to present our speakers for today. We have Elisa Johnson. She's the Northeast Iowa Food and Fitness Early Childhood Coordinator. It's an initiative committed to reaching young children, their parents, and providers with farm to early care and education to improve health, local food access, and educational development. She holds degrees from Winona State University in Winona, Minnesota in communications and sociology. After that, we'll hear from Ellen Schmidt. She's a doctoral student in Northeastern University's School Psychology PhD program. Her research focuses in the development, implementation, and evaluation of school and community-based initiatives to promote healthy eating and physical activity among preschoolers. As a school psychologist, she hopes to support schools in making systems-level changes to better promote healthy behaviors among children. Great. With that, I'm going to turn over control to Elisa. And Elisa, please take it away.
Thank you, Lacey, and I appreciate sharing today and welcome everyone to the seminar. So my first slide.
See, I'll go ahead and, oh, there we go.
There we go. So we have in Northeast Iowa, we have created a transformational parent engagement model, and our big focus is parents as partners. Through the design and the development and the assessment over the last few years, we have discovered primary messaging that we have done and coaching techniques that have emerged from the process. And these techniques, we now understand more clearly the experience that we created and that we create with the parents are truly critical to changing parent behaviors regarding healthier family choices. So my first question to you is, what is transformational parent engagement compared to traditional parent engagement? I'm sure all of you have heard of engaging parents and what you want to do with them, but there's two distinct differences. Hands-on experiential learning and not lecturing or coming in as the expert. No one likes to be talked down to. No one knows their own child better than the parent does. So we never come in as the expert. We come in as a partner. We want to partner with these parents. And you can see by this picture, I'm in the middle. I'm working across from a couple moms. There's a gentleman in a cap, and he's shredding cheese, and he's a dad and he's never done it before, but we're there next to him. There's a gentleman in a yellow t-shirt who just came off of work, who's dirty, who had the baby that the lady across in front of the refrigerator is holding on to. So we all work together. We're all parents and we're all partners. So really, what does that mean? It means sharing responsibility, building relationships with parents, looking for continuous improvement, consistent messaging. That's really important, to be consistent in your messages to parents. And this is key, guilt-free parent engagement. No judging, no blaming. We've all been behind someone in the grocery store looking in their grocery cart thinking, I can see what they're going to eat tonight. And sometimes we do, just being human beings, we do judge what other people do. So this is our coaching model, and I'm going to go to the circular part first. First of all, in the middle, it's parents' engagement for transformational behavior change. So in the red circle, we first want to know what behavioral focus we want to change. Is it changing the way they eat, the type of food they eat, the way they eat with their children? There are families who don't eat together. So we want to know really what we're looking for. In the green is the next step, and it's really to build relationships to motivate behavior change in parents and in the families. And then the third step is to create a comfortable learning group environment, a safe space, so to speak. And in the final small circle, it's always communicate as partners, not as experts. So what drives parents to change behavior? Well, we have a few things that we've used in our method, And we have found out that experimenting with new foods and skills while discovering unknown talents of the parents that they didn't maybe even know they had. As I said before, safe social spaces. So we want to cultivate a comfortable space that's positive and fun for the whole family to enjoy. And again, it's that no shame, no blame. Partnerships are another piece. Being inclusive of all families. Introduce the concept of teamwork and relationships. Partnerships should be strength-based and a shared responsibility we feel in transformational engagement. We also want to be purposeful. What will work for their family in their home? We're not all alike. Some things work for some families while it wouldn't work for others. So we try in little thing of looking into their home situation, if they're willing to share that with us, and do a little investigating and a little solutions as partners. We can give them ideas, see if it works, if it doesn't work. We also try and change their palate maybe a little bit in a behavioral change by experiencing a variety of textures, of flavors, of cooking methods, different things. That is another thing that will drive parents to change behaviors. Also, connecting other parents with other parents, and then still other parents. They all have friends. So finding a shared values and commonality in behaviors, they seem to naturally congregate together, feeling more comfortable. So we want to encourage that. Also, I'm not a big person who's in favor of recipes because we can all have the same recipe and it will taste differently. But we like to learn different cooking techniques and from different cultures even, and to be comfortable with changing recipes. For example, I don't think there's a vegetable that you can't roast in the oven. So it might take different times, different temperatures, but it is a technique of learning to cook. And then we want to build capacity to help change parents' behaviors, to enhance their shopping skills, their cooking skills, even their leadership skills, to become influential leaders for other parents. And we continuously try to have improvement with competency, so they're comfortable in the kitchen with food, or they're comfortable in the grocery store, and the experiences to advance and become more comfortable with change. So we really are trying to build the parents' capacity through engagement events. And I will talk a little bit about those. We do grocery store tours, and maybe some of you have participated in some grocery store tours or even have done some yourself. We have a model, and I'm going to run through this. We really suggest that you tap into an existing system like Head Start or other groups of parents. And we all know promoting tours for the entire community usually doesn't work. So we try to identify and contact existing groups of parents through schools, churches, libraries, story hours, any place where parents congregate. Then we work with the parents and schedules to find the best time for the tour. We realize that most parents work or they're going to school, and so they also need to have their time honored. The second thing that we think is important is offer an incentive to participate. We do work, especially with low resource parents that may work more than one job or often are busy with their kids' schedules. So we give them an extra reason to come to the tour and participate. We offer a $20 gift card to the grocery store as a door prize. And many a times the store will donate the gift card if they know that the people are from the community. We also offer maybe reusable shopping bags, calculators so they can figure out budget, or at times free childcare so they can actually attend and have the ability to listen. So we also want you to go in the tour with a plan, knowing what you will talk about during the tour. We talk about food groups, comparing unit prices, buying in bulk, food labels, buying in season. We also compare fresh, frozen, canned options. A lot of people don't have maybe enough freezer space for frozen, or they don't have the ability to keep things at a temperature when you buy fresh to keep it last longer. So we're not saying one is better than the other. We're giving them the option of what works best for them and their family situation. We always leave time for questions and suggestions and comments. And there are a lot of different programs out there that we suggest that you could use. Doesn't have to be ours, but there's a variety of them. Cooking Matters is one option I know that some people use, and that is a good program as well. Very similar to what we do. So that is. And then we want to provide a challenge. At the end of the tour, we give a limited amount of time for the families to shop for a meal for a family of about 4. And we want these to include all the food groups. We give them a $10 gift card to the store, and then they need to have a meal that's going to have all of the 4 food groups in it. It's a challenge, but believe me, it can be done. We get very creative. Maybe breakfast for dinner, maybe something special that your family likes, and just tweaking it a little bit. Also, you should have volunteers on hand to help. You need to maybe equip them with calculators to help the figuring cost of the produce, or how much it would be a pound, or to help with a variety of different things. We also encourage people to keep the group small. We do not want to clog the grocery aisles, and the group needs to be small enough so everyone can hear. We conduct the tours where participants shop. Wherever they shop most commonly is where we try and go, so they're familiar and comfortable with the environment. We also, if you need a translator, have a translator on hand. Not all meals are the norm for all people, just like not all ethnic groups or all languages are the norm. So we really keep that in mind. And don't be surprised if the group expands during the tour. We have noticed many times that, excuse me, other people in the grocery store will start following along with us to learn tips. So that's kind of an interesting outcome that we have always noticed. The other thing we do are we have family fun cooking nights. And the first step we usually do is work with a community partner to host the event, such as, like I said before, a church, libraries, schools. It could be at soccer practice and we do something afterwards. But we need to find a kitchen that has enough space for people to work in. We have to have a location where parking spaces and maybe it's in walking distance, because not everyone drives, of the targeted families that we want to connect with. We also do limit our liability with a safe space and plenty of help. So we choose the menu and the food ingredients. Food should be here. We think they should be local, seasonal, easy for the families to access, not have to go to a special grocery store or a special aisle within a store, and little or no processed food. Usually something with 5 ingredients or less, and nothing too complicated to prepare, because not everyone is a great cook. Maybe they're just a beginner. It's important to choose a date and time, and to remember families' time frames again. They are busy. You need to kind of see when a good time is. Respect the cultures and their celebrated days. Schedule a minimum out of 2 weeks so that you can advertise and also send out reminders. We need support to make sure you have enough volunteers or staff to help, and offer child care supervision if needed. And we have found that we've used 4-H Club, Boys or Girl Scouts, or other student groups can be an option as well, as long as we're all there together. So you also need to secure resources, planning tools, and checklists for food needed for the menus, cooking supplies, eating utensils, take-home containers for families to take leftovers home. Then you need to really prepare to lead. And you want to welcome everyone to a safe, comfortable environment, make them feel welcome, introduce the recipes or the foods that you're going to prepare. You need to create hand washing, food prep, cooking, eating, and cleanup areas or stations so everyone knows where things are. And like I said again, be inclusive of everyone and include the parents and the children. Children can even help cook. And then finally, you need a final planning list. You need to confirm the space and whoever the community partner is to make sure they're still on board. Confirm for yourself that you remember it. Confirm for your volunteers, and confirm with your families who's coming. And then last, but certainly not least, enjoy the group and the conversation. So our main thing here in our model is to understand that parents are influencers. Parents have much more influence than they ever know over their children, their children's eating habits, things that happen in their household. We want to empower them through helping them know how to cook, helping them know how to shop, to budget, and where they can find things. Again, thank you for listening, and I will have a handout that I will be happy to share.
Thank you so much, Elisa. It's so wonderful to see that model and understand how that applies to some of these great farm to early care and education family activities. We'll look forward to that handout. And for the attendees, as you do have questions, if you have questions about the activities that Elisa shared or the model that she shared, please enter those into the question box, and we'll have plenty of time to answer those at the end of the session. For now, I'd like to go ahead and turn it over to our next speaker. Ellen, you can take it away.
Great. Thank you so much, Lacey. It's great to be part of this webinar today to talk with you about the Farm to Family program. My name is Ellen Schmidt, and I'm a graduate student working with Dr. Jessica Hoffman in the Applied Psychology Department at Northeastern University in Boston. Dr. Hoffman has had a central role in this project from its development, but unfortunately she wasn't able to join us today. However, I'm happy to be here, and my involvement in the project began in 2014, but I'll be speaking today about the history of Farm to Family starting from before my involvement. So back in 2009, Dr. Hoffman collaborated with other professors at Northeastern and with Boston Children's Hospital to form Healthy Kids, Healthy Futures, which is an initiative focused on promoting children's engagement in physical activity and healthy eating in underserved neighborhoods in Boston. So Farm to Family is just one example of a program developed and implemented by Healthy Kids. Just trying to advance the slide.
I can go ahead and advance for you, Ellen.
Thank you. Great. So given our focus today on family engagement, my goals for this presentation are to describe how families' voices were instrumental in the development of this program, then to talk a little bit about how Farm to Family is a way to engage families in healthy eating through a school-based model, and then finally to describe how families' feedback has been solicited over time and used to refine the program. So, oops, now it looks like I am able to advance the slide. Let's see. There we go. So before explaining exactly what the Farm to Family model is, I want to discuss how the model came to be and how families' voices really influenced this process. So in 2010, a local farm had expressed some interest in serving low-income families, and they reached out to Healthy Kids to collaborate on how we might be able to make that happen. So given our existing partnership with Head Start programs in Boston, we thought this could be a great context for us to do that work. But we really wanted to know whether families would be interested in this idea and how we could move forward based on their ideas. So to really gain their understanding, we conducted interviews with families using a survey format when parents came to pick up their children at Head Start. So we first wanted to know whether parents were interested in the general idea of getting vegetables through Head Start. And we found that 93% of parents were interested in that. And of those who were interested, many more were interested if it was going to be at a reduced price or if they could pay for the produce with their SNAP benefits, as opposed to a much fewer percent said they would still be interested if they would have to pay full price. So we knew we would want to pursue a model that included subsidizing produce for families. We also wanted to know how parents felt about different potential formats for this model. So the two most popular formats were a weekly community-supported agriculture model where families would receive a farm share each week, and a farmer's market that might take place near their school. Having cooking classes or participating in a buyer's club were less popular ideas among families. So based on the resources available to the team and the feasibility of different options, the CSA model was the one that we selected to move forward with. But before we designed the details of that, we again really wanted to have families' input on some of the nitty-gritty of the logistics. So we held focus groups with families to find out how this might work for them if they were able to receive a CSA farm share at their program. So rather than having a traditional model where families would travel out to a farm to pick up a CSA, we were going to pursue a model where the CSA farm shares were delivered right to the Head Start program to eliminate that barrier that's really something that prevents low-income families, especially in urban areas, from being part of a CSA. So in these focus groups, we asked families about how much produce would be reasonable for them to have each week, that they would be interested in having each week, whether they would need this to be in a box or a bag, whether it would be feasible to bring this produce home on a train or a bus that they might have to take with their child at pickup, and what different kinds of produce they might want to see in this farm share. So after getting all of this information and input from families, we developed the farm to family model. So this is a subsidized community-supported agriculture model with an overall goal of increasing access to fresh, affordable vegetables in low-income families with young children who attend Head Start. And as I mentioned, the boxes are delivered each week to the Head Start site. So some more details about the model. It runs from July to October, and it's actually been implemented from 2011 all the way through last summer, and it's in the works to happen again this summer, so even beyond 2016. And through this model, families pay about $7.50 a week for $22.50 of produce. And they're able to pay either in cash or using their SNAP benefits. And the way that we're able to make this happen is that we have a mechanism for subsidizing these shares, where participants in sister farm shares who are paying full price for their shares are asked in their paperwork when they sign up if they're interested in making a donation to subsidize a share for a low-income family. So we suggest $80, which would subsidize for one family, but we accept any donation from those who are interested. And this has been a really successful model for us, and it's really enabled the model to thrive without grant funding and continually over time. So on a weekly basis between July and October, the farm that is working with our group is able to deliver these farm share boxes right to Head Start. And to make this all happen, we have site coordinators at Head Start who have a role in really being a champion for the program and recruiting participants, which are families who attend, to make sure they understand what farm to family is and whether it might be something they're interested in. The site coordinators are receiving and distributing the weekly shares and reminding families if they've forgotten to pick up, and then also handling all payments. And this is something that's just rolled into these staff members' normal duties, so it's not an extra task that they might have to stay late to do. We've worked with Head Start to roll it into their normal responsibilities so that it's not overwhelming for them. One thing I want to mention regarding collecting payments is that CSA farm shares often require participants to pay upfront at the beginning of a growing season for the full year, which really creates a barrier for low-income families. So we're able to have a model where families pay on ideally a monthly basis, but sometimes even more frequently, so maybe every other week for their share, so that it's possible for them to afford it. So now that I've gone through the different components that make up farm to family, I want to highlight some of the ways that the model engages families. So first, the model itself is really targeting healthy eating at the family level, not just among children through classroom activities or educational approaches, which are certainly extremely valuable, but really this model is thinking about how to connect the family with the school and think about the family as the source of change, given the important role that adults have as healthy role models for children. So beyond receiving the farm shares, families are also getting a newsletter each week, and this is an example here on the slide, where they can see different the descriptions of the produce that are in the box so they understand what they're getting. There's ideas for recipes that they can cook with that produce. There's ideas for how to involve children in the kitchen while they're cooking recipes, and really just a way to keep a connection between the farm as well as healthy kids with the families who are part of this program. We've also included nutrition education materials, so beyond just getting the particular supply of healthy food through the farm share box, other ideas for promoting healthy eating with children. And then beyond just these different components of the model, we've also come up with other ways to really connect families to the school setting that are kind of using this model as the pathway to do that. So one example has been family farm field trips. So families were offered an opportunity to take a bus out to one of the farms and to really see where the produce comes from, how it's grown, and to help their children understand what it takes for them to receive their box every week. We've also held cooking demonstrations at Head Start at pickup time. So parents are coming, they're getting their farm share box, and this is another way for new parents who might not know about the model to find out about it by seeing and getting to taste test different sorts of recipes that are made with produce from the boxes. And then similarly, we've had tasting nights where families are able to come and meet members from the farm and from healthy kids who have made the model happen, along with Head Start staff, and to receive different tips for eating on a healthy budget, different recipes for the farm share produce, and then also to talk to a nutritionist about some healthy tips for eating within their family. So the final topic that I'll review today is how we've been able to really use families' feedback to refine the program over time. So this program's gone on since 2011, but it hasn't stayed the same across all of that time. We've really tried to make an effort to listen to what families have to say about it, to continually improve it and make it something that families are excited to participate in. So one way that we've done this is through end of season surveys. And at the end of the season, after these surveys, we have different members of the group come together in a meeting where we sort of review the feedback so that the Head Start staff, the Healthy Kids staff, the farm staff can all gain a deeper understanding of families' experiences with farm to family and brainstorm ways to make improvements based on the feedback. So some things that we've learned from those surveys are that families often want to see more fruit as opposed to vegetables in their farm boxes. They're really interested in new ways to prepare food. They've been interested in picking up on a bi-weekly basis or only for part of the growing season. And they've also wanted to know where food comes from and learn more about the farm share food. And so some of the components I just spoke about previously really came to be out of this feedback. So the farm visits and the recipes, these were ideas that grew out of families' interest. And in terms of being able to pick up for part of the growing season, what we've been able to do is keep a wait list of families. Sometimes we don't have enough subsidies to support every family who's interested, but we know that some families don't want to participate for the whole growing season. So by utilizing a wait list, we're able to allow families to stop participation if there's a reason that comes up, and then to give the opportunity to another family, or to have families share a farm share so that they might be able to pick up every other week and not be overwhelmed by the amount of produce. So through these surveys, we've also asked families about their opinions regarding the produce in the boxes. So this is an example from the 2012 end of year survey, where about 75% of families said the amount of produce was just right, and 20% said it might not quite be enough. In terms of the selection of produce in the boxes, about half were very happy with it, and another 30% were somewhat happy with the selection. And then we also asked about quality, and we found in this year that about half were very happy with the quality, and another about 30% were somewhat happy with the quality. So getting this information also prompts us to think about ways to make sure families are kind of learning about how the model works and maybe some of the reasons that the selection of different fruits and vegetables is the way it is, why it's maybe not possible for us to always have quite as much fruit as families might want to see, and how quality might vary week to week just based on what's available from the farm's crop for that particular week. And then a second example of getting family feedback comes from focus groups that we've conducted. So one of the former project managers for Healthy Kids, Tara Agrawal, conducted a focus group with, or a few focus groups with families to really gain some more in-depth knowledge about their experience with the program. And what she found when she sort of qualitatively looked at families' feedback from this focus group was that their general impressions of the program fell into two broad categories. One that she described as being a lesson in every bag, and a second which she categorized as viewing the program as a little bit more of a hassle. And I'll explain a little what I mean about that. So those families who viewed the program as a lesson in every bag, an example of that sort of response is the first quote where a parent said, "I think there's a lesson in every bag because you have to figure out, okay, now what is this vegetable if you've never seen it? And then you have to figure out how to use it and how to eat it." So different families came up with statements similar to this one where they were maybe curious and really interested in exploring the different kinds of produce that they were getting and were learning from that experience. Another parent shared, "Because I'm bringing home my little bag from school, I always say, here's their school recipe. So I don't really hear as much complaining about trying zucchini." So what Tara learned from these responses is that participants who viewed the program as a lesson in every bag were also likely to be families who are already buying fruits and vegetables but wanted a more affordable option. They were the one that picked up the farm share. That adult was the same one who was usually responsible for preparing meals. And then children and adults in the home were usually open to trying new fruits and vegetables, and caregivers were interested in being creative with cooking and trying new recipes. So the second group of participants were characterized as viewing the program as more of a hassle. So an example of this is a parent who said, "I just think it's like more of a hassle when you don't have the time, because right now I have a bag of produce on the top of the refrigerator rotting." So you can see from this response that some parents might see it as a little overwhelming to use the produce every week. Another parent shared, "It's more prep time, that's the only thing. It's bad in a way if you're trying to hurry up and get everyone fed, but it's good because it's fresh." So it wasn't necessarily that these families viewed the program negatively, but just that they might have had a little more of a challenge figuring out how to use the produce. And among these families, they generally were characterized as wanting to increase fruit and vegetable consumption, but it wasn't necessarily that there were fruits and vegetables in the house beforehand. So being part of the program was a new way for them to get access to fruits and vegetables. It was often the case that the caregiver who picked up the farm share was not the same one who was responsible for preparing meals. And children in these households were more likely to be picky eaters, and other family members weren't as interested in trying new fruits and vegetables. And these families had time pressure for cooking to a greater extent than the other group of participants, and were maybe not as open to following recipes. So the focus group information that I just outlined really provided a more nuanced understanding of families' experiences and highlighted some of the reasons why the program may be viewed as a hassle to some families. So getting this kind of information has been important for the group to consider future approaches and changes that might make the program more acceptable and beneficial to the subset of families, particularly who were still participating but viewed the program as more of a hassle. So just to conclude, the Farm to Family program was built in close collaboration with families and has been implemented over the last 6 years using family feedback to make changes over time. And it's a way to engage families in healthy eating using the school as the context for that. So some of the strengths of this program have been that it's a way for low-income families to access fresh vegetables easily and affordably and without transportation barriers. And it's also offered a valuable opportunity to be linking home and food school environments and promoting family engagement. So it's great to present to you about Farm to Family. If you have further questions, please feel free to reach out either to myself or to my advisor, Dr. Jessica Hoffman at Northeastern, and we'd be glad to share more information with you about the program.
Thank you so much, Ellen. It's so great to hear about that program and the impact that you are having on children and families in that community. Please do continue to enter your questions into the question box for both of our presenters, and we've got about 15 minutes for some great question and answer time. So my first question is for both of our presenters. As you are following up with parents or looking at impact on parents' behavior change, do you see changes in how they're engaging in the food system? Are they going to farmers markets more? Do they have more interest in engaging on the local food system?
This is Halisa, and yes, we have tracked that. We have done the events that I told you about, the grocery store tours and the family cooking nights for about 6 years now. And so we do track it. We do see parents now more comfortable going to farmers markets, to shopping within a grocery store, and we talk about shopping in the perimeter. So we do see that they are not as intimidated about reading labels, more knowledgeable about how to store food. So yes, we have seen some definite behavioral changes.
That's great to hear that you've seen that kind of generalization. I think for the Farm to Family program, I don't know that we've specifically looked at that, although it would certainly be interesting to get that information from families. But what we have seen is many families choose to come back to the program year after year and have had a positive experience with it and are interested in continuing to be consuming healthy, fresh, local food. So that's, I guess, one positive thing we've seen carry over from year to year.
Great. Our next question is for Ellen. Ellen, one of our attendees noticed that on the family newsletter, it looks like there were page numbers under the list of vegetables. Is that part of the newsletter, or is there additional resources? Can you talk a little bit more about those resources that are provided?
So the newsletters, are you skipping to that slide, Lacey? Or are you going to the end? To be honest, I'm not exactly sure what the numbering there pertains to. There are newsletters that are provided throughout the season. In terms of the number of vegetables, it may have corresponded to the particular ones in the box for that week. But I think that's the most detail I know about that.
Great. Okay, another question for Halisa. Halisa, you mentioned talking about enhancing and promoting leadership for parents. Could you talk a little bit more about how you enhance parents' capacity as leaders through these farm to early care and education activities?
Yes, we really, as I said early on, our model is based on parents being partners. And so we try and build their leadership within the groups. So they are comfortable maybe helping, mentoring, leading, guiding other parents that are in the group or even outside of the group. So we try and build confidence in a way. We try and talk to the parents to see what their strengths are. It's amazing that some people have strengths in gardening or cooking, or maybe they used to work in a restaurant and they know techniques, a variety of things that surface when we start visiting with them. So we really encourage them in their leadership skills to be leaders to other parents if they know something. For example, in grocery store tours, they may be a WIC mom. And so when we talk about the grains and what they are looking for, and they always come forth with, well, it should be a whole grain. And so they're familiar. So we build off their confidence in that topic rather than jumping in and telling the whole group as an expert, yes, that should be your choice. So we do that. And we also then encourage them to be a leader at home, in the kitchen with their family, also teaching at the same time as eating, teaching about nutrition. I hope that answers the question.
Great, that's really helpful. It sounds like it's really thoroughly embedded in your program and approach to really empower parents. Another question for Ellen here. How many families are able to participate in the program at one time before going onto that wait list?
That's a great question, and it's something that's varied year to year. So there have been years when there have been up to like 70 participating families at one time, and it's depended on the amount of subsidies that are raised through that mechanism I spoke about. So I know in a recent summer we were down to more like 30 families that were participating, but we've also been able to expand to multiple sites aside from the first Head Start program. So we've also been in a community center where children are attending a summer camp there. So there have been years where we've spread out the available shares across numerous sites, and then there have been wait lists at each site. But we've had it, I'd say, between 30 and 70 families each year.
Great. Another question for both our presenters. Our question from the attendee is that preschoolers are known for being very picky eaters. Do you find that there's anything within your model, or are you initiating anything new that might help parents address this picky eating through these programs? Or have you seen any impact on parents being able to address that picky eating within these approaches?
So
Go ahead, Ellen.
Okay, great. In terms of farm to family, I think that's a great point, and certainly there's variability across families, but I think the combination of having the taste tests while families are picking up food so that there's different examples of how children might be more likely to taste something if they're, seeing an adult also tasting, other children also taste, that's been really helpful. We've also conducted some pilot research looking at eating behavior change for preschoolers as well as parents as a result of the program. And using a parent self-report measure, we did find that there were increases in children whose families participated in the program in terms of the variety and the quantity of produce that they were eating as compared to preschoolers who were in a control group. So we have seen some positive and promising impacts of the program.
That's really great, Ellen. And I agree with Ellen, her comments about preschoolers and having the small taste first. Don't expect that you're going to fill their plate with something and they're going to eat it all. It is one step at a time. So I think preschoolers also have different, their taste, they're not just doing the taste, they're doing the textures, they're doing the flavors. So when I talked about cooking techniques, sometimes kids will like carrots raw, but they don't like them cooked. Or they'll like something cooked but not raw. So I mean, it's working with that and working with the families to not, as I said, fill their plate with something they haven't tried before. Let them just taste it. And maybe it's different techniques of tasting, or different, the raw versus the cooked versus a seasoned. I'm not a big supporter of dipping things, but if you can dip vegetables in something kind of low fat and they'll eat it that way, I mean, that's one way for them to eat vegetables.
That's great. And, I think both of your comments really point to the opportunities that we see in farm to early care and education by offering these multiple exposures and multiple ways and multiple settings that can help enhance that likelihood that kids are going to try and enjoy those new, healthier food options. So this is for a question for both presenters as well. Can you speak a little more to the funding for both of your programs? Let's start with you, Ellen.
Sure. So the way that we've been able to fund this program has really been through this approach of subsidizing farm shares. And the way we've been able to make that happen is by working with a community neighborhood coordinator who is involved in kind of outreach efforts to support programs for low-income families in the communities we've been working in. And they've been able to take a role in the process of creating the flyers that go out to participants who are interested in the full price farm shares. And people signing up for the full price farm shares do so a little bit before those at the Head Start program signing up for the Farm to Family program. So by having that kind of delay in the time frame a little bit, and just a real presence of making sure the information is in every flyer that higher income participants are seeing to sign up for the program, we've been able to have that success with raising enough funds to fund the subsidized shares.
This is Halisa, and we are Northeast Iowa Food and Fitness Initiative. We were very fortunate enough to have W.K. Kellogg Foundation funds for a decade, and then that ended a couple years ago. They really, we were very fortunate. They chose us in early childhood to continue. And so we've had funding for the last 2 years, and we will be getting funding for the next 2 years. But even with that, we've been fortunate to have other small family foundation funding that's local. But our Head Start program we've worked with for over 7 years. And our Head Start program actually is funding their own food for cooking nights now. It's in their schedule. The curriculum is embedded. And also our local grocery stores are more than willing to give us a $10, $20 gift card for families to come in to their store, and we're kind of marketing their store for them, I guess indirectly, by teaching the parents how, or working with the parents how to shop.
Great. It sounds like from both of you, it really underscores that need and necessity for community-based relationships that really help support and sustain these efforts. One more question for both presenters. Have either of you used within your programs Grow It, Try It, Like It by USDA? And what other curriculum or educational resources and tools do you use or recommend?
This is Halisa, and yes, we have not used that, but Head Start did prior to using. We have created our own curriculum, which is Together We Grow Healthy Kids. You're more than welcome to have access to that, and I can send that with the handout with Lacey. It is Together We Grow Healthy Kids. In the curriculum we wrote, 2014 was the first year it was published. Wrote it with a team. It does cover all the STEM, or STEAM as in early childhood, adding art, and it does align with our Iowa learning standards. So you're welcome to have it, and it's online.
Great. We'll be sure to send that out along with a follow-up email. Ellen, do you have any recommendations for tools or resources?
Sure. Within Farm to Family, to my knowledge, we actually haven't used particular curriculum in combination, although that's certainly been something that we've been thinking about, so that we're having sort of an influence on the home food environment and concurrently having activities in the classroom and education in the classroom. I think combining those two things is a great future direction for Farm to Family. One curriculum that we are have thought about using is the Harvest for Healthy Kids curriculum that Betty Izumi's developed. Jess Hoffman, my advisor, has done some work with Betty Izumi around this curriculum, and it's really a beautiful hands-on curriculum for preschoolers to be used in the classroom around tasting new local foods. It's developed for produce in the Oregon and Washington area, but could probably be adapted for other areas. So that's one recommendation that I have.
Lacey, this is Halisa, and I want to address that our focus here in Northeast Iowa, or in Iowa in general, is to have local food and Grow It, Try It, Like It. A lot of those weren't local food for us. So that's one reason why Head Start really was looking for something else. So I'm just letting people know that.
Great. We'll be sure to send both of those resources out so folks can have access to those. One more question for you, Ellen. Would you be willing and able to share samples of your survey questions and focus group questions?
Sure, our team would be happy to do that. I think the easiest way might be if the participant who's interested in that could contact myself or Dr. Hoffman with that inquiry, and we can figure out what of those tools would be most helpful for you. If you're interested in tools we've used to measure eating behavior change, we use the CDQ, which is the Children's Dietary Questionnaire, which is kind of a checklist format where parents are doing a recall of children's eating in the last 24 hours and 7 days. Other tools for surveys and focus groups we've developed ourselves, but we'd be happy to share about them.
Great. And Ellen and Halisa and my contact information are all on your screen right now, so please feel free to reach out to any of us with any additional questions. I want to give a big thank you to our presenters today. They have fantastic insight on the work that they're doing in different locations across the country, and hopefully it's given you some resources and tools and ideas for how farm to early care and education can really move family and parent engagement forward in the early care and education settings, and also start to meet many of these programmatic requirements and building healthy environments both at home and in early care and education settings. So thank you so much for attending. A big thank you to our presenters. You will receive a follow-up email with many of these resources as well as a link to the recording. And we hope that you'll join us for our future webinars. Have a great day and thanks for joining us.